nephrolithiasis, which does not require surgical intervention. I mean to say that tiny ureteral stones or nephrocalcinosis, these are a common condition that we physicians see almost daily in our OPD. We advise patients for conservative management, and patients most often ask us what are the foods they should take, what foods they should avoid, and what are other lifestyle interventions that they can adopt in their daily life to prevent nephrolithiasis. Since this is a common condition, I would like to talk on this today. So, regarding prevention of kidney stones, recurrent nephrolithiasis, there are some general measures that we advise to all of our patients regardless of the type of stone. Kidney stones are of different types. There are different types of crystals. Some may be calcium phosphate crystals, some calcium oxalate crystals, uric acid crystals, cystine crystals. There are multiple types of, or the composition of kidney stones are varied. But for all these types of kidney stones, there are some general measures that everyone should adopt. First of all is adequate water intake. What do I mean by adequate water intake is that you should have at least 2 liter urine output daily. You do not need to take 1 liter or half liter water in a single drink, but you can take multiple frequent drinks to keep your body hydrated, and that also prevents kidney stone. So that is water intake, not other calorie containing beverage, but I am telling water intake, right? Second is low sodium chloride intake. Sodium chloride is a common salt that we consume. So if you consume low sodium, what happens that low sodium gets filtered in the kidney tubule, and since there is low sodium in the serum, tubules starts reabsorbing those sodium. So in the process of reabsorbing sodium from the tubules, it also reabsorbs calcium from the proximal tubules. So if calcium ions are absorbed from the tubules, there will not be enough calcium in the tubules to precipitate. In that way, it prevents calcium stone. But as all of us know, salt adds taste to food. If there is low salt, then food does not taste good. So what you can do is that if potassium chloride salt is available in your area, you can use potassium chloride, because potassium, if you take potassium, it does not leads to a stone, but high sodium chloride causes nephrolithiasis. So sometimes you can consume sodium chloride, sometimes potassium chloride. Potassium chloride also tastes same as sodium chloride, but it may be expensive compared to sodium chloride salt. So this is the second thing that I advise, that to reduce salt intake. So how much to decrease? I generally advise to take less than 2.5 gram. Third thing is that reduce animal protein intake. Animal protein means meat, flesh, these are animal protein. They have done some studies, and I was just a couple of hours ago I was reading that study. If you reduce animal protein intake, it decreases the chance of all types of stones, uric acid stones, calcium phosphate stones, calcium oxalate stones. So instead of consuming more animal protein, shift to fruits and vegetables. This has also been shown to decrease kidney stone. Fourth is, if a person is overweight or obese, try losing weight, because if you lose weight, this also decreases risk of nephrolithiasis. I am not just saying these things theoretically, but these are evidence based. You can search it. There has been multiple studies on these things, and they have solid data to show that reducing weight in overweight patient decreases nephrolithiasis. So these are the four things: adequate water intake, decrease salt intake, reduce animal protein intake, and decrease body weight. So these four measures I advise to all of my patients, regardless of the kidney stone, regardless of the composition of kidney stones. Now there are some things that I advise to a particular type of stone. I mean, whether it is calcium phosphate stone or calcium oxalate stone or uric acid stone. Why do I tell based on the type of stone? The reason is that calcium oxalate crystals get precipitated if the urine is acidic. Calcium phosphate gets precipitated if urine is alkaline. Uric acid gets precipitated when the urine is acidic. Right? So what is the pH of urine? What is the urine environment? If urine is acidic, calcium oxalate and uric acid stone gets crystallized, and that type of a stone forms. If urine is alkaline, calcium phosphate gets crystallized, and that calcium phosphate stone forms. So if patient has calcium oxalate crystals in their urine, or patient has uric acid stones, then I advise patients to take some foods that make their urine alkaline. So you can take citrus fruits that has lot of citrate. Citrate converts into bicarbonate in the blood, and that makes urine alkaline. And in alkaline environment, this calcium oxalate cannot crystallize. And there are also some drugs available like potassium citrate, potassium bicarbonate, those common syrup. But those drugs I only prescribe if there is recurrent stone formation despite patient is adhering to dietary lifestyle intervention. But those are also options. And avoid oxalate rich foods. So you can search on internet what are oxalate rich foods, like spinach, green leafy vegetables, and almond, peanut. These are high in oxalate. So if you consume increased amount of oxalates, these oxalates will be excreted in the urine, and there they will form calcium oxalate crystals. So if patient has calcium oxalate stone, then decrease the consumption of oxalate containing foods. You might be thinking that then if calcium is also reduced in the diet, then that also prevents calcium stone formation, because calcium is the culprit, no? But it is not like that. You should take enough calcium in your diet. This looks contradictory, right? If you take enough calcium will excrete in the urine, and that will precipitate calcium stone, you might be thinking. But there is other viewpoint. The viewpoint is that when you take enough calcium, this calcium binds with oxalate, because there are many foods containing oxalates, and calcium binds to oxalate, and oxalate cannot get reabsorbed in the GI tract, and it gets excreted in the feces. In that way, taking enough calcium decreases calcium oxalate stone formation. So do not restrict calcium containing diet in your food. Instead, restrict oxalate containing foods. But at the same time, you should also not consume calcium supplements that come in tablets, over the counter nutritional supplements containing calcium. You should not consume those, because those increases risk of nephrolithiasis, but not foods containing calcium. So take the calcium as there is requirement of your body. Don't restrict calcium in your diet. And regarding uric acid stone, again, uric acid is synthesized from protein rich foods, particularly animal rich proteins. So decrease those kind of foods that contains increased proteins, from which uric acid gets synthesized. And we also have drug called allopurinol, febuxostat, to decrease the production of uric acid. So we also prescribe drug if patient is not able to manage her symptoms with dietary lifestyle intervention. So drug is also option. And another drug is thiazide diuretic. Thiazide diuretics like hydrochlorothiazide, chlorthalidone. These drugs, what they do is that they reabsorb calcium from the tubules. So if calcium is reabsorbed from the tubules, there is low calcium in the tubules, and so calcium crystals cannot get precipitated. So drug is also option, but we reserve the drug if lifestyle intervention does not help.